But right now we want to talk about what's happening right here at home. We want to tell you that the number of COVID-19 cases continues to grow statewide. As we have reported, there have been 6 newly confirmed cases here in Nueces County in the last 24 hours, bringing a total to 7. That's where we stand right now, 7 confirmed cases. But right now we want to bring in Governor Greg Abbott, who joins us live to talk about the impacts of this virus on our state. And first off, thank you so much, Governor, for taking the time to talk to us. You're a very busy man right now, but we have limited time, so I want to get right to it. Thank you. Governor, action has been taken to limit social gatherings to no more than 10 people. Some local governments are taking that step even further, ordering lockdowns or even asking residents to shelter in place. Have you received any feedback from counties that have taken those measures, and are you considering a statewide lockdown?
Listen, I've received feedback from all the different kinds of counties in the state of Texas. As you know, we have more than 250 counties in the state of Texas, and almost 200 of them have no cases of COVID whatsoever. So from the large urban areas, they wanted to impose standards even stricter than what I imposed in my executive order. And they are great in doing so because that may be the right fit for them. There are other counties where the local mayors, the local county judges, they appreciate the fact that they have the latitude to decide what is best for their citizens. Bottom line, you need to know this. The standard that I issued last week was built upon and consistent with what the CDC ordered. So I've been in contact with the people that you're watching on TV right now. It could be Dr. Fauci, Dr. Deborah Birx, who's on national TV right now, talking about what the American approach is toward dealing with COVID-19. And Texas has adopted the standard that those doctors laid out and that the CDC mandated. So we thought that would be the best approach for a statewide approach, but making sure that there is flexibility at the local level to have tougher standards. And let me give you one more but. What I have observed so far is inadequate compliance with either the standard that I established or the standard that other local officials have established. It is necessary, everybody watching this program right now, that you do your part, comply with our standards, make sure that you're practicing good distancing practices, make sure that you're not out in large groups of people. You have to make sure you do your part to stop the spread. Otherwise, the United States and the state of Texas will be required to impose stricter standards. Your freedom is in your hands. If you're going to do your part and be responsible, you have to stop the spread of COVID-19.
Yeah, personal responsibility. You know, Governor, workers have been laid off. As you know, businesses have had to shut down. What about the workers? How is the state planning to help people who have been impacted by this virus in other ways?
Listen, the impact for workers has been devastating. And I've already issued some executive orders to assist those workers who've been laid off. For one, I waived all these different kind of complicated red tape regulations that delayed people from getting unemployment benefits. You don't have to wait 10 days. You don't have to be searching for another job. You can maybe work in part-time and still get unemployment benefits. But in the package that the United States Congress is working on as we speak, it looks like there's going to be far more aid provided, including some unpaid sick leave as well as additional unemployment benefits for our workers. So hopefully that package will pass out and that will be a great help for our workers. But listen, we all know that what our workers want is not so much help from government. They want to be able to get back to their job as quickly as possible. Right. The thing that will get everybody working again the swiftest is for everybody to comply with these orders that you do not spread COVID-19 or the coronavirus. The sooner we can stop the spread, the sooner we will get back to business as usual.
The sooner we can get out of this. And of course, Governor, the workers on the front lines of this health crisis are in the hospitals. You said earlier in your press conference that you are asking anyone who's in the healthcare profession if they want to come to Texas and help us out. They're very much welcome. Is our state, though, properly equipped for this virus?
You know, part of what you're talking about is the healthcare workers, and we will need additional healthcare workers on the front lines of combating COVID-19. Some of those that can come from out of state, some they could come out of retirement. Some are practicing medicine or health care in what are called elective procedures, which are now banned in the state of Texas by my executive order. We want to put all of these healthcare workers on the front lines to assist in treating those who have contracted COVID-19. With regard to the supplies, know this. Also announced today that through multiple strategies, our office is now receiving 1 million face masks a week. So that we will be able to provide the face guard that's so desperately needed by these healthcare workers. But after I made that announcement, right before coming in here right now, I just placed an order for 20 million of those face masks that are needed by the healthcare workers. So we're going to have ample supply for the doctors, for the nurses, for the healthcare providers to make sure we will be able to combat COVID-19.
And Governor, while we're on that subject, what about testing? What else can we expect more testing throughout the state, and when?
We have ramped up testing dramatically. As of just a few days ago, we had only tested 2,000 or 3,000 people. As of today, we are well over testing 11,000 people. That shows you how much we're increasing. The same increase is occurring nationally. Dr. Birx was just on TV moments ago talking about how the United States government is providing us all the supplies so that we are ramping up. She compared the United States approach to where we are right now to this prolific testing that had been taking place in South Korea. She says on a timeline basis, we are ahead of where South Korea was at that time. So we are moving very rapidly in ramping up testing. You'll see a lot more tests in Texas, but let me warn you and let me warn your audience. Because we are testing more people, that will show that more people are identified positive for COVID-19. That is something we are expecting. Just know that once we do the advanced and increased testing for a week or two, the goal then is for that to level off.
And lastly, Governor, earlier also in your message, you said something wonderful. You said, we are Texans. Let's show everyone what we can do as Texans. What other encouraging words can you say to folks here in the Coastal Bend who are watching us tonight?
We see the way that Texans respond to challenges from the earliest of our times to as recent as Hurricane Harvey. Everybody comes together at a time of challenge, and we lift up each other and we get together and we unite. And let's do that same thing and approach it that exact same way in the response to COVID-19. The more we do that, the more we will overcome this and get back to work as normal.
Oh, can't wait for that day, and we will get through this. Governor, thank you so much for your time and for your leadership during this time of crisis. We really appreciate you taking the time today. And we are going to let you know that for up-to-date information on all the news that are surrounding the COVID-19 crisis, just make sure to visit our website at christv.com.